to the boat.
After almost 25 years in the ER, this is a first for Nurse Maricar Cabral Osorio.
Oh my God.
There is a shark still attached to her patient's leg. And he's trying to save the shark by keeping it covered in water.
Shark attacks are actually very rare. You get more chance of getting hit by lightning. But because we're near the beach, I've seen my share of shark attack victims.
So this was not an April Fool's joke?
It's July.
And this by far is the craziest situation ever.
Ow! Good. That's what I wanted you to say. Sensation's intact. Let's type in crossing. 2 units O-neg, in case he needs a transfusion. Let's get him a warming blanket.
We can't allow trauma victims to get cold because if they get cold, they'll go into shock. And that's how they die.
I'll get you something for the pain, all right?
As long as it doesn't get into the shark system.
Right. 5 milligrams of morphine IV, 2 grams cefazolin IV. Let's get him a tetanus shot.
I'm hoping to do anything that will get me away from the shark, even for a minute.
Let Julie do that. I need you here.
Sure. I have a bad feeling. I know what the doctor is gonna ask me to do.
I need you to apply pressure directly to the wound, or as close as you can.
Yep, that's what I was afraid of. I have to put my hands right near the shark's mouth again, and I have to keep them there.
Now, how are we gonna get this thing off?
So it might help if you know some things about nurse sharks.
I take it you do?
Yes. We're all in school together at the Oceanography Institute.
So enlighten me.
They have thousands of teeth.
Literally.
And they have a unique way of suctioning onto their prey when they bite.
So I have to relieve the suction and open the jaws.
Essentially, yes, but don't worry, they're docile.
So you keep saying, I don't care how docile this shark is. I don't care. I don't like shark's teeth.
You good?
Yeah.
All right.
I'm gonna have to be holding pressure on the wound while the doctor tries to open the shark's mouth. Great. So the doctor's trying to use 2 tongue depressors to try and pry the shark's mouth off.
I hope this thing is as docile as you say.
Me too.
Nothing's happening. The shark just doesn't care. It's not budging.
I know you're the doctor, but I don't think a couple of wooden sticks are gonna do the trick. Their jaws are super strong.
Their scientific name is Ginglymostoma serratum, which is Greek for curled hinged mouth. So, you're dealing with that too.
This is more than I ever want to know about nurse sharks.
What if we try a retractor?
Good idea.
Retractors are stainless steel, so I figured it'll be a lot stronger. Plus, it gives you a little more leverage.
Come on!
No! Oh! Do something! Don't just stand there! Oh!
The patient is screaming at us, and I assume it's because the bleeding is scaring him.
We'll get the bleeding under control. Julie, get that O-neg stat. I want to do an ultrasound.
No! The shark needs more water right now. He's not gonna survive like this!
The patient's losing a lot more blood than we can transfuse it, but he's still more worried about the shark. I feel like I'm in some sort of horror movie. I'm an ER nurse. How did I end up taking care of a shark?
We could just get water from the water cooler.
It has to be salt water.
Can we get salt packs from the cafeteria and add them in?
Won't be enough. Salinity of the ocean is 3.5%.
What about saline? It's almost 1% sodium chloride. Can we do that?
Let's try it. What else are we gonna do?
I'm pretty impressed with myself for coming up with the idea.
Let me go get some bags. Julie, can you come over and take over for me?
And the bonus is, I get a break from holding my hands next to the bajillion teeth of this creature.
Make sure to get enough.
How much do you think we need?
Like 25 gallons?
Right. Hey, you're big and strong. Come with me.
So I know what I actually need to do, but I don't know if I can actually make it happen. But I did. we go back to the trauma bay with 80 pounds of saline.
Nurse Maricar Cabral Osorio has gone to great lengths to save a shark.
Jordan, can you hear me?
Now her patient needs some heroics.
Jordan.
We were okay trying to save the shark while a patient was stable, but now that he's passed out, our priorities have changed.
His hemoglobin is very, very low.
We're giving him blood as fast as his body could tolerate, but he's still not regaining consciousness.
We are authorized to be here, and this tank is part of our equipment.
Amy!
The marine conservationist shows up with this giant tank of water.
Thanks for coming.
Yeah, just another day at the office.
Yeah, me too.
Hey there, tough guy. You're gonna be okay.
Now, all the tension is back on the shark.
So here's what we're gonna do. This stuff is called tricaine methensulfonate. It's a sedative. We're gonna give this to our determined little friend here, and he should release the leg on his own within a few minutes.
Well, there's no time like the present. Surgery should be here in a minute.
So they pour in the sedative. Nothing happens.
So, how long does this normally take?
Right. So this can happen sometimes. The shark relaxes, but the teeth remain embedded.
So now what do we do?
Okay, a little gentle prodding out to the mouth. Nothing too invasive.
So now we're back to having to pry the mouth open again.
That'll work.
And I'm just glad it's not my hands stuck near the shark's mouth this time again. But the one thing we were not expecting was for the patient to regain consciousness.
Make sure he didn't sustain any trauma in the fall.
There's a shark resuscitation going on the floor.
So dizzy.
Lay back. Stay still.
I'm soaking wet with God knows what, and I'm concerned that my patient could bleed out and die.
Grab my otoscope. I need him in the tank now.
It's like there's two patients in the room, but one is not even human.
Give me the sandbag.
Thankfully, the vascular surgeon arrives right when he said he would.
Oh, so this is not an April Fool's joke.
It's July.
All right, then. Let me have a look. All right, let's save a life.
He's gonna be okay, right?
I hope so.